The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of thousands of participating companies, only the top 4 in each category are selected as finalists.
Hi, my name is Sanjay Basu. I'm a primary care physician and one of the co-founders of Waymark, a public benefit organization that seeks to improve access and quality of care for people receiving Medicaid. We deploy and train teams of community health workers, therapists, and pharmacists, along with telemedicine solutions and psychiatry solutions, to help patients who are receiving Medicaid and their primary care doctors. The interventions that we deploy have been found by independent scientists to return about $2.50 on average for every dollar invested. How does this work? One of our key technology platforms is a set of machine learning algorithms that help us identify which people to intervene on, with which intervention, and at what time. For example, let's take people with diabetes. About 1 in 10 Americans has diabetes, and there are many different medications to choose from. Some of the medications can be revolutionary. On the other hand, the same medication for a slightly different person can result in a severe adverse event, one of the major causes of emergency department visits in the United States. However, there have been many randomized trials and meta-analyses or network meta-analyses, which allow us to compare amongst different drugs. And when we train our machine learning algorithms on these meta-analyses, we're able to see which complex constellation of features allows one patient to benefit from a drug and their neighbor to perhaps have a severe adverse event. We've developed specific algorithms and tools so that our staff can do personalized benefit and risk calculations and incorporate people's individual preferences, such as whether they'd like to avoid an injectable medication. We populate these kinds of interventions in our own patient management software that allows us to rank which patients to outreach, with which intervention and through which modalities. And critically, it allows our staff to provide feedback. For example, our staff notice things that data scientists often don't, such as that people who are taking insulin and are food insecure tend to get their hypoglycemia visits towards the end of the month for diabetes. Why is that? People who are food insecure often get food stamp benefits towards the beginning of the month and are running out of food towards the end. And if they're taking insulin, can get dangerously low blood sugars. We were able to target a food voucher intervention towards the end of the month, which, if scaled nationally, could avert about 5,000 emergency department visits and hospitalizations every year. This type of intervention to address health equity and improve health disparities is the kind of thing that motivates us at Waymark.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.